for February 21st. There's a couple of things I want to do and discuss. First, we'd like to welcome Ethan Ivy. Where are you, Ethan? Come up here. He is is going to be working with us this entire session. He's at Montevallo, and he's working on his political science degree. Actually was in D.C. last week to present his research. So we're glad to have him this year. So thank you. Maybe you will learn the good things and forget the bad things you see. We do have a new member, and we just learned that today, and he actually had prior commitments. So District 16, Representative Brinyark will be our new member. So he will be coming in maybe a little late, and we will chastise him when he walks in the door and teach him to come on time. No, he knows. I've told him not to worry about it at all. Another little clarification. I know it was last year, year before last, we had different bills with scope of work, and I worked on a committee where Representative Lipscomb will receive scope of bills if we deem necessary, and we will either appoint, or I will appoint 3 to 5 people on that board or on that committee to look at the scope of practice and just make sure there's no issues, that all the things are covered, and that we're not overstretching what we should be doing in whatever area it may be. So just letting everyone know in the future that will be the case and remind you of that. All right, Ms. Michael Ann, if you'll call roll.
Representative Lee.
Here.
Representative Lipscomb. Here. Representative Hall. Representative Sorrells. Representative Mooney. Representative Warren. Representative Marcus. Here. Representative Gray. Representative Rafferty. Representative Paramore. Here. Representative Rigsby. Here. Representative Holt-Jones. Representative DeBose. Representative Shirey. Here. Representative Brinyark. You've got a quorum.
Representative Paramore, is this your first on here? I noticed you were late. Representative Paramore is from Troy, so we're glad to have you.
Thank you.
I think you'll be a great addition as well, and we were very thankful that you were willing to do this. All right, if you'll call the first bill on the calendar, HB 69 by Representative McCampbell.
Representative 69 by Representative Campbell. Controlled substance prescription database access by certain representatives of a dentist authorized.
Thank you, Mr. Chairman and committee members. I'm going to do one of the old things. This is a very simple bill, very non-controversial bill. So what we're doing, we're actually have a code that allows the medical doctors to have 2 employees designated by the doctor to dispense and prescribe or administer controlled substance who may access the database of those controlled substance. And this is just to extend what is already being done in doctors' offices to the dental offices. So that's the essence of this bill, and I'll answer any questions you may have about that.
I think there being none, I got a favor report. Representative Sorrells. Okay, Representative, we have a second, and all those in favor by saying aye. Aye. Those against, nay. Bill is confirmed.
Thank you, Mr. Chairman and committee.
Okay, second on the agenda.
House Bill 70 by Representative McCampbell, Board of Dental Examiners of Alabama to create limited special volunteer license for non-resident dentists and dental hygienists to increase fee for annual dental hygiene registration to add fee for issuance of special volunteer license.
Okay. Mr. Chairman and committee members, this is it too is a very simple bill, and I'd like to thank the Board of Dental Examiners for the issue and the quick attention to this issue that we had over in my area. We have dentists that are part of a organization, but they are not dental hygienists nor are they dentists from this area. But they will come into an underserved area on once, maybe even twice a year over a weekend and will come through and provide dental services free of charge through this organization for people that do not have the means or the health insurance to get this dental care. So they originally, a dentist that would come in for that pro bono work had to buy the full license for a full dentist for the whole period of time. So it limited our ability to get people to come in and help with that. So they were so kind as to change that and allow for a fee for these dentists to be changed. And you'll see it on the last page. I think it was the dentist and the hygienist. Is for a special volunteer license dentistry. The fee now is $150, and for a special volunteer license dental hygienist, it's also $50. Now, the good thing about this that I like is we're also maintaining the requirement that a local dental dentist be a part of that service over that period of time so that they can follow up if there are any complications. So with that, I'll answer any questions, Mr. Chairman.
I'll move for a favorable report.
I have a motion by Representative Lipscomb. Yes, sir, Representative Rigsby.
Thank you, Representative McCampbell, for bringing this. I have two questions for you. Who, under the scope of care, I know it says in here that the an Alabama licensed dentist has to be
Yes.
overseeing it directly.
Yes.
Does that patient become a patient of the Alabama dentist, or is it a patient of the out-of-state dentist?
Now, that's one I probably need to get a little help with, Mr. Chairman, if
I see somebody saying it'll be the Alabama dentist. So the Alabama dentist will keep all the records for that patient. Okay. Second question, the licensure time frame, it says that it'll be 15 calendar days in a 30-day period. So can they pick and choose those 15 days, or is it 15 consecutive days in a 30-day period?
Now, I think this is to be 15 consecutive days is what I think it is.
So why the language for a 30-day period? They can only be here 15 days in a 30 days? Is that the rationale behind that?
Okay, now
Yes.
I've got to get,
That's what,
okay.
It can be the first 15 or the last 15 or the middle 15.
but they can't do 15 first to the 15th and then another 15, 16th through the 30th. So they can't work a whole month in the state. It's 15 out of 30, and then they could do another 15 next month if they needed to. Thank you. Thank you
All
for
right.
answering that.
Thank you for that question. I have my back up here. And, you know, we sing a good song when we sing together.
Okay. Any other questions? I have a motion by Representative Lipscomb. Second by Representative Marcus. All those in favor by saying aye.
Aye.
Those against, nay. Bill passes with favorable report.
Thank you, Mr.
Thank you.
Chairman and committee members.
Okay. All right, next on the agenda, Representative Rigsby, HB 52, dealing with the Board of Pharmacy.
Thank you, Mr. Chairman and members. I have one of those easy bills, is what I was just told.
We're starting out.
Just easy.
Oh, no, it gets worse, guys.
Well, yeah, that's what I hear. This is a Board of Pharmacy bill. Currently in the Board of Pharmacy statute, they changed the ratio of pharmacist to technician ratios for all pharmacies in the state so that you have one licensed pharmacist and 4 licensed technicians. Of those 4 technicians, 2 of them have to be nationally certified if you're going to have the 4-to-1 ratio. In the code, unfortunately, compounding pharmacies had a specific ratio named, which was a 3-to-1 ratio. So all this is doing is clearing up that language specifically for those pharmacies who compound so they can work under that 4-to-1 ratio like every other pharmacy in the state. And so this is just really just a language clarification so that that ratio applies to all pharmacies now, and it doesn't just exclude compounding, those who compound.
This basically gives consistency across the board.
That's exactly what it does.
Any questions? Favor report by Representative Marcus, second by Representative Shiree. All those in favor by saying aye.
Aye.
Those against, nay. Bill passes with favorable report. Thank you. All right, next on the agenda is Representative Rigsby, HB 77, dealing with newborn screening panel.
Members, I am excited about this bill, and I'm excited to introduce the namesake of this bill, sitting in the front row here, Mr. Zachary Thomas. Mr. Thomas, I met at a breakfast last year for the newborn screening kind of introduction in the State House, and Zachary has a rare genetic disorder called MPS 1, and currently in the state of Alabama, we test all of our newborns for rare diseases. There's a panel called the Recommended Uniform Screening Panel that is put forth by the Department of Health and Human Services that states that these tests need to be tested. Now, you may ask, why are we testing these things? Why are we doing this early? For these rare genetic diseases, most of these diseases, if caught early, you can really be treated fast, quick, and effectively so that we can make the quality of life for these patients better. For our families with newborns, this can be a scary yet comforting thing to know that we caught this early and there's something that we can do about it. Currently in Alabama, the Department of Public Health only tests for 33 of the 37 recommended tests. And so what this bill would do is to say that we have to test all 37. And this is a bill that's agreed upon by the Alabama Department of Public Health. They worked with Alabama Rare, which is an organization here that promotes the newborn screening. And so it puts a timeline that says we're going to do this within 3 years. Now, we're hoping 2 of the 4 come on this year. We're hoping MPS 1 and Pompe are 2 of the tests that are not being tested that we hope come on. That's the rare disorder that Zach and his 2 siblings have, actually, in his family. And so that's what this bill will do is really just to expand that testing to meet the recommended uniform screening panel that is recommended by the Department of Health and Human Services.
Okay. Zach, it is good to have you here. It was nice to meet you just a few minutes ago, so we're proud of you. Okay. Representative Shiree, you have a motion? Okay, we have a motion for favorable report. Second, Representative Warren. All those in favor by saying aye.
Aye.
Those against, nay, and the bill passes with a favorable report.
Thank you, Chairman and members of the committee, and congratulations, Zach.
Okay. Zach, you will